It's really one of the few medical models that takes into consideration the entire person.
We do a lot of counseling, we do nutrient and diet therapy.
Naturopathic doctors are masters of prevention.
They're like your offense. They optimize your health and they keep you well.
I would describe it as primary care. It's using as least invasive and least harmful modalities to maintain and to restore health.
Naturopathic medicine is licensed in 18 states, and that is not enough, which is why I have this strong desire and passion to go to Washington, D.C. every year, because I believe that we need to have all 50 states licensed.
Without legislation, we can't grow, we can't offer our medicine to the wider populace.
Laws deal with everyone, and if you want to do as much good for as many people as you can, you have to get involved in legislation.
We have to realize that we can only operate and diagnose and treat people under certain federal laws, and so if we aren't involved politically, we are going to either be truncated or totally could be eliminated from the healthcare process.
I think it's really important legislatively for naturopathic medical students or even naturopathic physicians to get involved, because that's how we show everyone else what our medicine is about, and that's how it becomes recognized, and that's how it can actually become a part of the current healthcare model.
Coming from an unlicensed state, I'm from Pennsylvania. I want to be a resource to my family, to my communities, but as it stands, I wouldn't be able to practice where I'm from.
So DC-5 is a DC federal legislative initiative.
It's a time when about 200 naturopathic physicians as well as naturopathic students go to DC.
It's kind of us coming together to actually educate legislators about what we do, what we have to offer.
The group that I was with actually met the chair of a subcommittee on health, and he came asking us, wondering about what is naturopathic medicine.
It's really just notifying each state, and we go into individual offices to educate people about what naturopathic medicine is, what we have to offer, how we can help the national health care crisis.
And then every year we have what we call asks, which are things that we go to DC to actually ask them for.
And something in the past that we've also asked for is loan repayment, and that's something that we are continuing to work on.
Just last year, we passed a resolution which was recognition of a Naturopathic Medicine Week, which, this year was the first annual Naturopathic Medicine Week in October.
Something that we're looking at this year is getting recognized as a profession to be included in Medicare.
I see that it's very important politically to allow federal funding for our ND residencies as well as licensure for each state. That's
how we expand, that's how we get insurance coverage, that's how we get into different states to offer our medicine legally and licensed. So legislation is essential for us.